So the advantages then of using patient-triggered ventilation is that the infant will control his own respiratory rate. The infant will continue to breathe and therefore will reduce the pressure inside his chest, and this will reduce the negative effects of positive pressure on hemodynamics. And there will be less asynchrony, better synchronization between the patient and the ventilator, and this will reduce the incidence of hypoxemic episodes, will stabilize arterial blood pressure, and will also decrease the work of breathing. Perhaps the most important outcome related to the use of synchronized ventilation is that it will facilitate weaning. A baby who keeps breathing on his own, only assisted by the ventilator, is a baby that will come off mechanical ventilation sooner than a baby who is controlled, where you are determining his respiratory rate and his blood gas. So this is a meta-analysis of the studies that were done many years ago to compare synchronized ventilation with controlled mechanical ventilation. And what you see here is duration of mechanical ventilation. And as you can see very clearly, babies who were ventilated with synchronization, with assist ventilation, spent less time on mechanical ventilation. In terms of bronchopulmonary dysplasia, the evidence with synchronization is less clear. There is only this paper many years ago from Dr. Bernstein in San Diego that showed that babies who were ventilated with synchronized intermittent mandatory ventilation had lower duration of mechanical ventilation, 596 hours versus 801, and also had a lower incidence of bronchopulmonary dysplasia, 72 in the controlled ventilation versus 47 in the synchronized ventilation. So this study done in a relatively small number of babies, but very small, under 1 kilo, suggested that the use of synchronization could reduce the incidence of BPD. This is the only meta-analysis comparing synchronized ventilation versus controlled ventilation in these two studies. And only one, the one from Baumer, again suggested that moderate to severe BPD was lower, although did not reach significance, but the other study from Beresford, with a smaller number of patients, did not show any significance. So the effect of synchronization on BPD is controversial. There is no strong evidence in favor of